Hi, I'm Gary White for Central Kentucky Television. I'm here with Bobby Harned, who is director of the Flaget Cancer Center in Bardstown. We're going to talk about an event that is coming up on Thursday, February the 27th, and it is a free breast cancer screening event, right?
Yes, it is. You know, the Flaget Cancer Center has been right beside Flaget Memorial Hospital. It's the building beside of Flaget, and it's been open for, we're going on our 4th year. And we provide comprehensive cancer care to all types of cancer patients. We provide chemotherapy, we provide radiation to patients with cancer. Dr. Monty Martin is our medical director. He's a medical oncologist, but he's also a hematologist, so he can see patients that have maybe anemia or blood clots or blood disorders. Flaget actually did a community needs assessment throughout Nelson County area and our service area and asked the residents, what do you think our community needs health-wise? And the top one was cancer. And the second was obesity, and the third was smoking cessation, or help to stop smoking. So we're really taking a proactive approach to try to get out there to the community to help people who may not have access to a physician or access to insurance in order to get some of the testing that's needed to diagnose cancer early. If you catch it early, we can treat it and cure it. But when you catch it in the late stages, the treatment is much more extensive and the cure rate does decrease with that. So our screening coming up on Thursday, February the 27th. It's in collaboration with the Susan G. Komen of Louisville affiliate, which is a grant that Flaget received, and this is our 3rd year receiving it. And the funding allows us to provide free mammograms to those women who may not have insurance, or if they have insurance that their copay is just so high they're unable to afford that copay. So the actual screening that we have is at the Cancer Center. Dr. Martin, our medical director, will be there, and Dr. Shannon Goley will be there also, and she is a breast surgeon at Flaget. She just received her certificate to do some cosmetic breast surgery, which is really exciting. So they will be doing the breast exams. If they determine that you need a mammogram, they will order it at that time. We can do that at Flaget. In the hospital, we have digital mammography, which is state-of-the-art equipment. And then if you need any follow-up testing such as a biopsy or any kind of a lumpectomy or anything like that, we're able to do all of that at Flaget, so it's really nice. If you don't have the insurance, as I said, the Susan G. Komen grant will cover that. So we're really trying to reach people out there that may not have the access to care.
That's fantastic. So there's no reason why you can't take advantage of this opportunity.
Absolutely. And you know, it's really important. I like to try to educate women on the best way to know if you have a change in your breast, and the best way is to do your monthly self-breast exams. You just need to be very diligent about it. Notice any changes that you may have, any lumps or bumps or any discharge that you may have from your nipple or any indentation in your breast area. So if you get familiar with your breast and if you notice a change, you need to notify your doctor. You need to call your primary care physician or your OBGYN, set up the appointment, and see if a further test is indicated. It's really a fun event. We're going to have door prizes. We're going to have refreshments for everybody and some giveaways. Everybody gets to take a treat back home. So it is for women, typically women over 40 is when you need to start getting your mammogram.
Okay. Now, is there an age for this particular grant?
No.
So anybody can qualify?
Anybody. And that's where the physicians that are volunteering, that's where they will come into play to say if you're of age or not. You know, if you have a strong history of breast cancer in your family, you may need your mammogram early, and that's where the physician's expertise will come in and let you know that. So we're really wanting to encourage everybody to take advantage of this free opportunity.
And you are asking for people to call in advance, right? So you have an idea of the numbers?
Yes. We're not going to turn anybody away, but if right now I currently have 2 physicians volunteering, but if I need to get more, I will, so that we can see as many women as we can, because it is just so important that we do take really good care of ourselves. You know, some things that you can do to decrease your chance of getting breast cancer is stop smoking if you smoke. I know everybody hears that if you're a smoker, but it does cause cancer. Also, exercise routinely. Just walking 30 to 40 minutes will decrease your risk of cancer. Being self-aware. If you're of the age to where you can nurse your children and you're having children, breastfeeding does decrease your chance of getting breast cancer also. So it's about being aware of yourself. Know your family history. If your mom, if your sister or aunt or grandmother had breast cancer, you're probably at a higher risk. So it's really important to make sure that you're diligent about it, your exams. Go see your physician annually and take advantage of these free opportunities. Again, it's at the Flaget Cancer Center. Give us a call to schedule that appointment. We're just going to make sure that there's not a long wait and that we have enough providers for you to come. And that number is 502-350-5700. And that's the Flaget Cancer Center. And we have several slots open. And I would love for everybody to come to just take a tour of the Cancer Center. Gary, I don't know if you've had a chance to be there or not.
Yeah, but I would love to maybe get some video of it too, so we can show people around. That'd be great.
Absolutely. It's really a calm zen feeling. When they designed the Cancer Center, they try not to make it really hospital looking, so it's got nice woodwork. We have a beautiful fountain. All of our infusion suites where we actually give the chemotherapy are private, and you have your own recliner that's massage, and we have heated blankets. You have your own TV with a DVD player, so they can come in and pop in a DVD. So it is really, really as relaxing as we can make it for the patients and the families, because it is a unnerving time when you walk in and you're not sure if you have cancer or if you have been diagnosed with cancer. So we have Dr. Monty Martin, as I said. He's our medical director, and then Dr. Joe Lanzillo. He is our radiation oncologist, and they're both right there on site together to where they can communicate about the patients that they share, and so that's huge to be able to have that.
That's great. You were saying with the study you had cancer first and then obesity and smoking, but the second and third one kind of can contribute to the factors of getting cancer.
That is absolutely correct. And controlling your weight does affect your chances of getting cancer. And actually, they have some opportunities at Flaget. We're going to have Walk with the Doc, so we're actually going to have physicians that volunteer. Okay. And we have a beautiful campus at Flaget with a walking path, and that will give them the opportunity to ask questions to the physician, but also get out and exercise. We do have the bariatric program at Flaget for the obesity, and we do a lot of education programs. So if you have any questions about those, you can call the Cancer Center at that 350-5700 number, and we can forward you to anyone else that may be in charge of those programs. And then as far as smoking cessation, I wanted to just briefly touch about our low-dose CAT scan for lung cancer early detection. Right now, we have mammography for breast cancer, we have your colonoscopies for colon cancer, but there really hasn't been a screening out there for lung cancer. Kentucky's #1 for lung cancer, so we're really, really trying to work hard and be very diligent about finding a way to detect this lung cancer early. And this low-dose CAT scan is a way that has been determined that is a good indicator and a good test. It doesn't require any needle stick or any IV, any medication, so that makes it nice. It's a quick test. It takes several slices of your lungs instead of a flat x-ray, just one flat image. So the physician is able to look in detail if there's any little lump or bump or nodule in the lung. And they're $185 right now. It's a one flat rate. That includes the test and the fee for the radiologist to read it. Currently, insurance does not pay for it, but we're really hoping that by the end of the year it will be covered by insurance. So that's offered at Flaget also. Smoking cessation goes hand in hand with diagnosing lung cancer early. If you smoke, you have to quit. And we have some classes at Flaget, Cooper Clayton classes, which are just several weeks in a row that you come in and we try to give you tools on how to overcome some of the urges that you have and find coping techniques. And our next class is actually tomorrow.
Okay.
At Flaget at the campus. I'm not sure about the time, but if you give us a call, we'll tell you the time. It's probably around 6-ish, and they last about an hour.
Okay, great. And again, that phone number is 502-350-5700. And the event for the free breast cancer screening is going to be Thursday, February the 27th from 3 to 5 p.m. So get signed up for that, and hopefully we can help get some early detections going on.
Absolutely. It's key to the survival rate and having more survivors out in the world, and that's what our goal is.
Super. Thank you very much.
Thank you, Gary. It's been a pleasure.
Right. I've been talking with Bobby Harned, who is the director for the Flaget Cancer Center. Again, call 502-350-5700 to schedule your appointment.